Hello and welcome to Books, Travels, History, and Tales. I'm CW, and today I have a tale of medical history that's quite notable. The setting is a time in Great Britain when the thought of anesthesia was just that, just a thought. Other than a drink of booze and biting a leather strip with your teeth, there was no escaping the immediate surgical pain that was going to follow. Surgery in this day required strength, mostly from your assistants, to hold down the patient, while the surgeon, who was super quick cutting speed, could manipulate, tear the flesh away from the bone, and then saw through the bone in record speed. A surgeon wanted to operate with such skill and speed, mostly for the patient to avoid ongoing pain and loss of blood, which could likely be fatal for patients. Now, Dr. Robert Liston was a native of Scotland. He was a good surgeon. He studied medicine at the University of Edinburgh. He specialized in surgery. He had a reputation of being an excellent surgeon. He became particularly good at quick amputations. God, it just doesn't roll off the tongue very well. He became known as the fastest knife on the West End. Ugh. Well, which was not a bad thing. He had a skill where most amputations in those days, 1 out of 4 of your patients would die. His record was 1 out of 10, so his skill was unquestionable. According to the British surgeon and writer Dr. Richard Gordon, Liston could cut off a leg in just under 2.5 minutes. He would, before every surgery, utter these words: "Time me, gentlemen, time me." Don't get me wrong, Dr. Liston was great at what he did. He invented see-through tape for wounds, invented the bulldog forceps, leg splints that were used all the way through World War II. Yet, fame seldom comes by itself. On occasion, he would grip the knife with his teeth to free up both hands. He was that type of surgeon. This can only get better. Robert Liston had several cases that are remembered by history, and what a memory it has. The first case was the fact that in 4 minutes, Dr. Liston was able to remove a 45-pound tumor from the scrotum sac of a man who had to use just a wheelbarrow to get around. Another case by Dr. Liston was what he thought might be an abscess on the neck of a young boy. Against the objections of an assistant who thought it could be a carotid arterial aneurysm, he said, "An aneurysm on such a small child? Unlikely," and immediately lanced what he thought was just an abscess. Unfortunately, the child bled out in record time and died. You can still see the artery. It's at University College Hospital in their pathology museum. I think it's number 1256 specimen. As I pointed out, speed was really necessary for amputations, mostly to avoid pain and loss of blood to the patient. Dr. Liston removed a leg on a patient 2.5 minutes. Unfortunately, that case, the man also lost his testicles. But Dr. Liston's most famous, or rather infamous, operation was that involving a simple leg amputation. He was timed at the removal under 2.5 minutes, but the patient died from hospital gangrene, kind of like a staph infection, which was not uncommon in the 19th century. Unfortunately, as I said, the strength of an assistant is also necessary for these procedures, and the assistant lost several fingers during the operation, thanks to Dr. Liston. Unfortunately, he also passed away from hospital gangrene. There was also a spectator, as this was a theater for medical reasons. He thought for sure that since Dr. Liston had accidentally cut through his coattails, that he also had cut through his vitals. And he collapsed and died there, right on the spot. That day, Dr. Liston participated as the only doctor in history for one surgery to have a 300% mortality rate. How do you kill 3 people in one operation? Wow. Remember, that's Great Britain. They have specialized medicine, socialized. You can't beat it, although you want to. Well, that's history, and it's all in the past. Not the good past. See you tomorrow when we talk about today. See you.